Hello and welcome to this bonus episode of Weight Loss 360 with Boots Online Doctor. This is the place where our experts get myth-busting and answer the questions everyone wants to know. I'm Helen Thorne, I'm a comedian and podcaster, and today we are joined by Dr. Anju Verma, the GP clinical lead for the weight loss treatment service at Boots Online Doctor. Welcome, Anju. Welcome in.
Thank you, Helen. Thanks for having me.
Dr. Anju, 3 years ago, I started my own weight loss journey and I did it through lots of different things like exercise and all that sort of stuff. I didn't use medicines, but it feels like that's the buzz thing at the moment. We're seeing it on social media. And I wanted to ask you about these medicines and specifically the weight loss injections.
Yeah, sure thing. And I think you've touched on what we want to talk about, which is the weight loss injections in particular for today. So before we get cracking with the injections, I think we need to know a little bit about what obesity medicine is and how things work. We want to understand what happens in the body under sort of healthy circumstances, if that's all right. Okay, so the medicines that everyone knows about are the GLP-1. GLP-1 stands for glucagon-like peptide 1, and it's a very critical hormone in weight regulation. So it gets released from the lining of the gut and also the brain. And its job is to tell us that we're full. So giving us that satiety signal after we've eaten. And the levels in the blood tend to reach maximal sort of levels about 30 minutes after our meal. So that's the GLP-1 bit and how that works. And then the next thing that I want to get our listeners to understand is really about something known as the gut-brain axis. And this is literally where the gut can talk to our brain and vice versa. And again, I'm simplifying things a lot here, but it can do this in many ways. So the hormones, GLP-1, that's one way. And we've got nerves that connect through and talk to each other, immune factors, and the newer sort of thinkings around the gut microbiome. So it's fascinating, the whole thing for me.
Yeah, I think that's it. I think we all have those conversations from our head to our stomach. Is our stomach ruling our head and vice versa? Yeah. And it's interesting that medicine can have an interplay or intervention in that.
Absolutely. That's sort of in health. And then if we think about it in terms of patients living with obesity. So something's not quite right with those signals and the hormones at play. And one of the thinkings, and there's many, but one of the thinkings is so the consumption of these ultra-processed, highly manufactured foods doesn't really help. Where our body would normally go about digesting foods and take its time and do what it needs to do, the ultra-processed food, that elements have been removed already. So we don't get the same fullness signals. We often end up eating more than we should, and it just causes a bit of a mess. These medicines have been designed to mimic the actions of the GLP-1 in the body.
I want to ask about the medicines. Who are they for? Do you need to qualify for them? Do you have to be a certain weight? How do people get these medicines?
So, yeah, there are some quite strict criteria of who they're suitable for. Just thinking about the GLP-1 medicines, they have been around for quite a while now, initially used to treat patients with type 2 diabetes, and one of the other beneficial effects was weight loss. And so some of them have had their licensing indication changed, and now they're approved as weight management medications alongside improved nutrition, increased physical activity. They're not for people who want to lose a little bit of weight quickly or, that quick fix thing. As we mentioned, it's not like a magic pill. And the other sort of really important criteria is the BMI with this, BMI body mass index. For weight management, it's a BMI of 30 or more, which categorises someone as having obesity. Lower BMIs can also be used for treating in weight management where other diseases might be present or the person's got other risk factors for developing conditions. So things like heart disease, raised blood pressure, fatty liver, problems with lipids, cholesterols, that sort of thing.
So I want to know, how do these medicines, the GLP-1s, I've got it right,
Yes.
How do they help reduce long-term health risks?
The long-term health risks are linked in with the weight loss. And so it's that reduces the risks of either developing conditions like diabetes and developing fatty liver or improving the outcomes. And there's quite a lot of research in that field now. But absolutely, that's what it is. But it's through the weight loss.
So if we're starting on these medicines, how much weight can we expect to lose?
Really good question. And from the clinical trials, the studies, they've shown that weight loss can be in the region of 15 to 20%. Now, just remember, these are clinical trials, very controlled settings, not necessarily real life. But again, they're a really good starting point. And it's really important to keep in mind being realistic about how much weight one might want to lose versus what is possible on this medicine or on medicines like these. And that's not the be all and end all. We need to think again of the bigger picture of health, the longevity, what else is going in. So again, we are going to talk again about nutrition and activity, keeping muscles strong, sleeping better, stress, all those other things. So these medicines are there, but all the other things are really powerful.
Yeah, because it has to be part of that holistic approach to lifestyle, because it isn't just about having half a sandwich or, less food. It's about all those changes, which are sustainable. I'm imagining people don't stay on these medicines for their entire life, but those habits are lifetime changes.
It's that lifelong behaviour changes that are doable, very real for people. Yeah. That's what we want to achieve. And so what's really important with all this weight loss that we're expecting is actually the health and the behaviour changes that go with using the medicines. And one of the most powerful things for me is when patients tell me the food noise has gone. And I just think, this is it. This is how the medicines work, because it then gives them headspace to make healthy choices, to make really nice decisions that they're proud of. So, that's brilliant for me.
Yeah. So food noise is that constant sort of messaging saying, I want more, I want more. That goes, how freeing is that?
Yeah,
that's really
totally
empowering. Yeah. I want to ask about side effects, because often with medicines there are side effects. What could people expect or should be cautious of?
Oh, absolutely. You're right. There's a long list of side effects that come with all medicines. And so with GLP-1s, the most common ones are those that affect the digestive tract or the GI tract. 1 in 10 users at least will get probably something like nausea, vomiting, diarrhea, constipation. And in a few cases, those can be pretty awful side effects, and in the same light, they're fairly tolerable for most people, and drinking plenty of water actually helps with all of those. It's just being mindful that we referred to it earlier. This is not a magic pill. It's a real medicine with real side effects, and sometimes those side effects are too much, and people will stop taking the medicine as a result. But on the whole, they work very well. Like other medicines, there are the potential for more serious side effects, things like pancreatitis, but thankfully that's not very common. And as I said, drinking plenty of water just helps.
Oh, and it's just generally a good idea.
It's a really good
idea. Exactly.
Absolutely.
So if you're having these side effects like the nausea or tummy upset, is there anything else you can take to help you with that?
Absolutely. And sometimes people will need to take something to help them through. A lot of things are available over the counter, and a friendly pharmacist will take you through a lot of these. But drinking water is key.
So Anju, thinking about the side effects, it might be interesting for the listeners to know a little bit more about what's going on in the body when you're using the GLP-1s.
As I said, it's quite complicated, all these interactions. But if we keep it simple, this is how they work. They help the person who's using the medicine feel fuller for longer. Part of that is the slowed down emptying of the stomach. So whatever we take in, it sits around for longer, so we don't take anything more in. But that effect just reduces with a bit of time, actually. That is not how it carries on working, but it's a start. The other effect is the brain effect. We've seen this in scans of the brain. So in patients living with obesity who were shown images of food and then had their brain scan, different areas of the brain light up. Now, if I have those same patients and I give them the GLP-1 medicine, those areas of the brain are not lighting up.
Interesting.
Yeah, absolutely fascinating. I totally
and
love this
is that
topic.
Pleasure or different
lots
sort of ways?
Different areas, but some of them are sort of the reward centres, some of the I'm interested in the food centres, and then subsequently the feeling full centres. So all of those, it's quite a bit. And so we've mentioned how the medicines work in terms of feeling full after eating, so the brain effects, the slowing down the gastric emptying. There's a couple of other things. So one, our listeners will have heard of insulin. Insulin is released from the pancreas in normal circumstances to use up the sugar that comes into our bloodstream from the food that we eat. This is a very normal process. And we know that in obesity, this normal process is somewhat hampered. And so GLP-1 medicines help that, which is why they were originally used in type 2 diabetes, is it encourages the pancreas to release insulin, and it does this in proportion to the amount of food eaten. So if we eat a lot of sugary stuff, more insulin will come out, and if we have less, then it will be less.
All right, so having less insulin is a good thing. As a very basic question, you want to have less insulin, or you release less insulin in your body?
So in terms of obesity, there is a whole other issue of insulin resistance. So the body's not really responding as well as it should do to this. And so GLP-1 medicines in that situation can help the body say, here's a bit more, use it a bit more effectively.
Also processing the sugars better.
So processing it better, absolutely.
Okay,
so that's which is a really important reason why they're effective for
And
diabetes.
so if you're not processing, is that you're storing more fat? Is that how?
Yeah.
Yes. Okay.
Yeah. In essence, yes.
All right. Good.
That's what it is.
Thank you. You've solved the mystery.
And then it does one other thing, well, amongst many. It blocks something called the secretion of glucagon. And so glucagon is another hormone in the body. And this is when our body will chuck out glucagon to increase blood sugar in our bloodstream when we might need it for more energy. And so the GLP-1 medicines stop that from going on. Now, importantly, so they have all these amazing effects. They work so much better with all those crucial long-term health changes that we can make, looking at our food, looking at our stress, looking at our sleep, all the other things that, again, we cover in so many of the episodes in this podcast.
Because that's what I was going to say, because I think people want a magic pill. They want, because they think, I can't, or I've got a busy life.
Yeah.
I've always lived this way. I've got no time. All those sort of things. It's like, if I could just buy a magic thing, that would do it. But it's not just about that. Obviously, you're making some changes, but it has to be ongoing. The other question I'm sure people are interested to know is, what are the long-term effects? Because it feels like they're recent drugs, but they have been around for a while. So do we know about any sort of long-term effects of these weight loss medicines?
Yeah, that is so important with all these new developments that come about. So GLP-1 medicines as a class or a group of medicines have been around for about 15 or so years, maybe a bit longer in some of them. And so we've got quite good data on those and longer-term benefits. There are newer medicines being produced all the time, so we don't have as much long-term data on those, but we know they're very effective for weight loss in the trials. What we do know very clearly is that there are long-term risks associated with obesity, and these are very real, very harmful. So the idea to then improve the outcomes, prevent diseases like heart attacks, prevent type 2 diabetes, reduce the chance of developing so many cancers that are linked with obesity are really critical for me. We've mentioned already it's not that magic pill, magic drug, magic injection. It's a tool to be used alongside all the other things that people can do to improve their health.
Okay, lovely listeners, that's enough for today. Weight Loss 360 is a fresh air production with Boots Online Doctor. The producer is Ollie Seymour. Thanks for listening. We're here to cheer you on, so remember to follow Weight Loss 360 wherever you get your podcasts. Now, although we've been focused on medicines for this particular bonus episode, at Boots Online Doctor, there are many free resources available, including this podcast, a 10-week weight loss support program, and live webinars run by Dr. Sam and nutritionist Ruth. The information shared here is evidence-based to help you achieve and maintain weight loss. However, if you have any health concerns or questions, please consult your GP before making any changes to your diet or lifestyle. Remember, every small change is a big step towards a healthier, happier you.